Very good afternoon to all of you. Namaste. So today we'll be talking about the silent thief of sight, which is called glaucoma, which is a worldwide problem and mostly in the developing countries. And glaucoma is one of the commonest cause of irreversible and permanent loss of blindness. So what is glaucoma? Glaucoma is a name given to a group of related eye diseases where the optic nerve is being damaged. So the optic nerve is found at the back of the eyeball, and that connects the eye to the brain. It carries all the signals from your eyes to your brain, and that is how that we are being able to see. The eye works like a camera. When you take a photograph of the camera, you connect to the computer to download a picture to the cable. Now, if the cable is cut, then the image will not get downloaded. In glaucoma, similar thing happens. Due to increased eye pressure, the optic nerve gets damaged and the image cannot form in the brain. Now, what is the eye pressure that we talk about, or the intraocular pressure? Now, similar to the air pressure in a car or a cycle tire, in eyes also, the right amount of internal pressure is essential for safety and performance. The normal intraocular pressure averages between 12 to 22 millimeters of mercury. Now, if your intraocular pressure is more than 22 millimeters of mercury, then your eyes are at a greater risk of developing glaucoma. A little bit of eye pressure is essential for good eye health. Without any pressure, the eye would collapse like a tire with a puncture. That's why the eye has a pump that produces a very small amount of fluid that circulates from behind the iris to the drainage channels in front of it. Now, if too much fluid stays inside the eye, it increases the intraocular pressure, and the high pressure damages the optic nerve. Now, how the Iop builds up. The aqueous humor is the fluid that we're talking about, and that fills the front half of the eye. This is similar to how a sink works. Now, the faucet lets in the aqueous humor and the drainage pipes would remove it. This allows a consistent intraocular pressure, keeping the shape of the eyeball perfect and your vision normal. But in glaucoma, what happens is that the drainage pipes are either blocked or not functioning properly, and that causes a rise in the intraocular pressure. Now, since the eye is in a bony socket inside the skull, there's only that much space for the eye to expand or bulge. The only outlet is at the back, where the optic nerve and the retinal vein exit and the retinal artery enters. Hence, all the pressure is put at that point, that is the optic nerve, and hence the damage occurs at that point. Now, what are the symptoms of glaucoma? Unfortunately, 90% of the times, there are no symptoms related to glaucoma. And that is why the patients would not come to us. In certain cases, like an acute angle closure glaucoma, the increased intraocular pressure may cause a sudden increase in the pain in the eye or ocular redness. You may also get severe headache. You may also see rainbow-colored halos around the eyes, along with nausea and vomiting. So in this particular condition, patients usually visit the ophthalmologist for an eye checkup because of the acute symptoms. So in the early stages, glaucoma has no symptoms and the vision stays normal. The optic nerve becomes more damaged with time when blank spots in the vision, in the field of vision begin to show up. But again, we won't be able to find these blank spots in your everyday activities because both the eyes, they cover for one another, and until the optic nerve gets seriously weakened and those spots get really big. So as the fibers of the optic nerve die, it results in blindness. So in the first picture, you can see that that's a healthy optic nerve. In the second picture, you see that the whiteness in the optic nerve is increased and there is damage to the optic nerve. So in the early and moderate stages, so patients may not be able to find the peripheral restriction in vision until in the very advanced stage, where the patient may feel that the vision is getting restricted as if looking through a tunnel. Occasionally, patients may complain of frequent change of glasses and they may visit the ophthalmologist, or they may complain of decreasing vision and headaches also. Also, if you feel eye pain in a darkly lit room or towards the evening, or you see colored halos around the light in the evening, so that is a time I think one should consult an ophthalmologist. There are different types of glaucoma. One is a primary open angle glaucoma, where the drainage angle, where the drainage through, the the drainage angle is open. And but again, what happens is that the eye's drainage becomes less effective over time, and slowly the pressure inside the eye rises, and that causes damage to the optic nerve. Sometimes even the optic nerve becomes sensitive to even the normal eye pressure, and they may undergo damage. So in this case, the drainage angle is open, but the roads are kind of jammed. So the intraocular pressure increases. There's another type of glaucoma called the closed angle glaucoma. Here the eye is structurally small from inside, and that causes a blockage in the drainage angle by an eye structure called the iris. So people usually who wear high plus numbers should get their eyes checked once for this type of glaucoma, or if your eyes are at a higher risk of developing the closed angle glaucoma. In this scenario, the fluid cannot leave the eye, and the pressure inside the eye rises, and may also at times lead to a acute attack of angle pressure glaucoma. So in this scenario, the roads are blocked by itself by the structure, and no fluid can pass through it. So regular glaucoma checkups would include us measuring your eye pressure. We look into the drainage angles, whether they're open or whether they're closed, and we do a very close examination of your optic nerve head. After a comprehensive eye examination, we also get test your complete field of vision by a test called perimetry, and some other tests may be required during the process. Now, diagnosing glaucoma is not always easy, and careful evaluation of the optic nerve continues to be essential for diagnosis and treatment. The most important concern is protecting your sight. Doctors look at many factors before making decisions about your treatment. The commonly used treatment are usually eye drops that requires to be taken daily, and it is very important to adhere to the treatment that has been recommended by a doctor for your glaucoma. And so there are fixed timings and dosing, and it is important to stick to it. There are other modalities of treatment also, like laser treatment, by which we try to increase the outflow of the fluid. And surgery is recommended if your ophthalmologist feels it is necessary to prevent further damage to the optic nerve. By this, we create a new drainage channel for the aqueous humor to leave the eye. Now, who are at the risk of developing glaucoma? Now, anybody who's above the age of 40 years should get an eye check at least once, so that the doctor can tell you whether you have any signs of glaucoma or your eyes are at a higher risk of developing glaucoma. Now, if you have been using steroids for a long time for any purpose, like if you're an asthma and using some kind of inhalers, or you have some kind of an eye allergy for which you have used some kind of over-the-counter drops that contain steroid, or you're putting any kind of steroid ointment or using oral steroids for any other systemic condition, you need to get an eye checkup for glaucoma, because it is one of the risk factors that increases eye pressure. If you are wearing glasses for distance and near also, like, very high myopia, or you are like in high hypermetropia, now your eyes may be at a risk of developing glaucoma. If you have any family history of glaucoma, so that becomes another reason to be checked. If you have any kind of eye injury, like you have been hit by a ball, or your eye was hit by a doorknob, or you had a history of fall, then you definitely must get an eye checkup. And also, if your cataract matures and has reached the end stage, the right cataracts may rupture, or by physical obstruction also, they may cause a high intraocular pressure with time. Also, it's not that glaucoma only develops in the elderly age group. Glaucoma can develop from even newborn babies to the elderly population. So if you see a newborn child or a child where the eye sizes have an asymmetry, or the eyes look big and blue now, or the child is shying away from light, has tearing, photophobia, then definitely the child needs a good checkup by the ophthalmologist for glaucoma. So to summarize, glaucoma is a disease where usually high intraocular pressure is the greatest risk factor. But it is not only that, your eyes may have glaucoma even if your pressures are within normal range, if you have other risk factors. Now, due to the high intraocular pressure, there is the optic nerve that usually gets damaged, and the damage leads to visual field loss. So what we need to do is that if you're over the age of 40 years, you have any other risk factor, you please get your eyes tested without fail every 6 months to 1 year. And if you have glaucoma, use a medication that a doctor has prescribed you regularly without fail. You should periodically get a checkup done every 6 months or as per the doctor advice. You should also take all your family members for a checkup as glaucoma is hereditary. Vision loss cannot be regained, but definitely further loss can be stopped by the appropriate treatment. So timely diagnosis and appropriate treatment are the key to glaucoma prevention. Well, does diet or exercise help? So these are the other things that we should do and we can do. Exercise lowers eye pressure and improves blood flow to the entire body, including the optic nerve. We should be avoiding smoking or secondhand smoke. Tobacco can irritate the optic nerve and may even worsen the disease. Also, avoid any kind of yoga or exercise where you have to hold your breath for a long time. Also, avoid drinking excessive water at a time. So you must drink water, but not excessive water at one time. Also, you must eat a well-balanced diet that is rich in vitamins A, C, and minerals like zinc and copper. And I think that, with a very good healthy lifestyle and a yearly eye checkup, definitely we can prevent the silent thief of sight problem. Thank you. Okay. A very good afternoon. Should I say good afternoon or good morning or what?
Good afternoon, ma'am. Maybe you can say hello, listeners, ma'am, like because the person who is listening.
Hi, everybody. Namaste. So today we'll be talking about the silent thief of sight, which is called glaucoma. Glaucoma is a worldwide problem and mostly in the developing countries. It is one of the commonest, irreversible, and permanent cause of blindness. So what is glaucoma? Glaucoma is a name given to a group of related eye diseases where the optic nerve gets damaged. Now, the optic nerve is found at the back of the eyeball, and that connects the eye to the brain and carries all the signals from your eyes to your brain, and that is how we see. The eye kind of looks like a camera. When you take a photograph from the camera, you connect to the computer to download the picture through a cable. Now, if the cable is cut, then the image will not get downloaded. Similarly, in glaucoma, due to increased eye pressure, the optic nerve gets damaged and the image cannot be registered in the brain. So what is eye pressure or intraocular pressure? Now, similar to the eye pressure in a car or a cycle tire, in eyes also, there's a right amount of internal pressure, which is essential for safety and performance. The normal intraocular pressure ranges between 12 to 22 millimeters of mercury. If the intraocular pressure is more than 22 millimeters of mercury, your eyes are at a greater risk of developing glaucoma. A little bit of eye pressure or the intraocular pressure is essential for a good eye health. Now, without any pressure, the eye would collapse like a tire with a puncture. That's why the eye has a pump that produces a very small amount of fluid which circulates from behind the iris to the drainage channels in front of it. Now, if too much fluid stays inside the eye, that builds up the pressure and damages your optic nerve. That happens in glaucoma. Now, the fluid that we're talking about is called the aqueous humor, which fills the in front of the eye. Now, this is similar to how a sink works. Now, the faucet lets in the aqueous humor and the drainage pipes removes it. Now, this allows a consistent intraocular pressure, keeping the shape of the eyeball perfect and your vision normal. But in glaucoma, the drainage pipes are either clogged or they're not functioning properly, and that causes a buildup of the intraocular pressure and a consequent damage to your optic nerve. Now, since the eye is in a bony socket inside the skull, there's only that much space for the eye to expand or bulge. The only outlet is at the back where the optic nerve and the retinal vein exit and the retinal artery enters. Hence, all the pressure is put at that point of the optic nerve, and hence the damage occurs at that point. Unfortunately, 90% of the times, there are no symptoms of glaucoma that are specific. So, but in certain conditions where the eye pressure has risen acutely, especially in a condition called acute angle closure glaucoma, there the patient may come to you with a sudden complaint of, sudden onset of redness of the eye, with extreme pain. The patient will have headache, blurred vision, and rainbow colored halos around lights, and they may also have nausea and vomiting. This is one scenario where the patient definitely visits the eye doctor because of the eye symptoms. So in the early stage and the moderate stages, glaucoma has no symptoms and the vision stays normal. With time, as the optic nerve becomes more damaged, there are blank spots that starts forming in the field of vision that begins to show up in a test for perimetry. However, in our everyday activities, now these blank spots are not noted because the one eye covers for the other eye. Until the optic nerve gets seriously weakened and those spots get big, as the fibers of the optic nerve die, it results in blindness towards the end of the disease. So in the first picture, you can see an optic nerve, the head of the optic nerve, which is normal. And the second picture, you can see the head of the optic nerve, which is severely damaged. So in the early and the moderate stages, the patient may not discover that his vision is getting affected until and unless in the advanced stages, where the peripheral constriction of the vision may be noted by the patient, which is akin to seeing through a tunnel. Occasionally, patients may visit you because of the frequent change of glasses. That is a subtle sign of glaucoma. Or the patient may come to you because of the heaviness of the eye or headaches that the patient gets or the decreasing vision. Also, patients may report to you if they complains of pain, if the patient complains of pain in a darkly lit room or towards evening. Now that is one of the symptom or a sign that the patient may tell you. Or during the evening hours, the patients may also complain of colored halos. So there are different types of glaucoma. One is the primary open angle glaucoma type, where the drainage angle is open but is not functioning properly, and that causes a rise in the intraocular pressure. Now, with age, the eye's drainage becomes less effective over time, and that also raises the pressure inside the eye, and that causes the damage to the optic nerve. In some patients, it's not only the high intraocular pressure that causes the damage. Some patients' optic nerve becomes sensitive to even the normal intraocular pressure, and when the doctor sees the optic nerve, the doctor comes to know whether the optic nerve has any sign of glaucoma in this scenario. So in primary open angle glaucoma, the drainage pathway is open, but it is usually jammed or blocked and it's not functioning properly. So there's another type called a primary angle closure glaucoma. This usually happens where the eye structures are quite crowded in the anterior segment, in the interior part of the eye. And usually it happens in smaller eyes and where the patient is usually wearing plus numbers. So I think they are the ones that needs to get a eye checked for this type of glaucoma, or if their eyes are at a risk. In this scenario, also the fluid cannot leave the eye because of the structural blockage, and that causes a rise in the intraocular pressure. So here the road itself is blocked, and that causes the buildup of the fluid inside the eye. Now, how's glaucoma diagnosed? So when you come to us for a regular glaucoma checkup, we usually measure your eye pressure. We look inside your eye for the drainage angles, whether they're open or closed. We do a very, very thorough examination of your optic nerve if there are very, very early signs of glaucoma. After that, we also make you undergo a test for perimetry, where we measure your visual field, and some other tests like a pachymetry, where we measure your central corneal thickness, or an OCT may also be recommended as needed by the doctor. Now, diagnosing glaucoma is not always easy, and careful evaluation of optic nerve continues to be essential to diagnosis and treatment. The most important concern is protecting your sight, and the doctors look at many factors before making decisions about your treatment. Now, if you have glaucoma, then the eye doctor may prescribe you certain medications to keep your pressures down by recommending certain eye drops, which requires to be taken every day. Now, the medications have a different dosing, and time schedule. So, and it is very, very important that you need to stick to it and adhere to it for a very, very good outcome. Doctors may also prescribe you laser treatment, by which we open up the drainage angle and also increases the outflow of the fluid. Surgery may be recommended if your glaucoma is advanced or intraocular pressure is not getting controlled by medications or laser. And by surgery, we create a new drainage channel for the aqueous humor to leave the eye. Now, who are the risk of developing glaucoma? Usually people who are above 40 years of age requires an eye examination so the doctor can look into your eyes and tell you whether your eyes do have any sign of glaucoma or they are at risk of developing glaucoma. If you are using steroids for a long time, like if you have asthma and has been using inhalers containing steroid, you have any eye allergy and you have been taking over-the-counter drugs, you have any kind of systemic illness for which you are taking steroid, then you definitely must go and check your eyes for glaucoma, because steroids tend to increase the intraocular pressure many a times. Or you must also get an eye checkup done if you have high myopia or a high hypermetropia. If you have a family history of glaucoma, definitely. And also if you have high blood pressure or diabetes or hyperthyroidism, then you must also go and get your glaucoma checked. If you have any kind of eye injury or trauma to your eye by a ball hitting by a knob or any kind of fall, then definitely yes. Also, if when your cataracts ripe, they may rupture or they may physically also block the drainage angle and cause a rise in intraocular pressure. Glaucoma does not only develop in the elderly population. Glaucoma can develop from newborn babies to the elderly population. And if you see any newborn child or any child with asymmetry in the eye size, or a newborn child where the eyes look big and blue, or the child is shying away from light, has photophobia, or is tearing, then definitely the child needs a checkup for glaucoma. So in a nutshell, glaucoma is a disease where the intraocular pressure generally rises, but you may also have glaucoma when the pressures are within normal limits. So the doctor needs to see it. Now, due to the raised intraocular pressure, there's damage to the optic nerve, and that causes a loss in your visual field. Now, what do we do? You need to do. Now, if you're above 40 years and have other risk factors, definitely you must get your eyes tested without fail every 6 months to 1 year. If you have glaucoma, use the medication that the doctor has prescribed you regularly without fail. You should periodically get an eye checkup done every 6 months or as per the doctor's advice. You should also take your family members for a checkup as glaucoma is hereditary. So the vision loss cannot be regained, but further loss can be stopped by appropriate treatment. So timely diagnosis and appropriate treatment are the key to glaucoma prevention. Now, the other things that you must do is that exercise. Exercise lowers eye pressure and improves the blood flow to the entire body, including the optic nerve. You must avoid smoking or secondhand smoking. Tobacco can irritate the optic nerve and may even worsen the disease. Avoid any kind of yoga or exercise wherein you are holding your breath for a long time. Also avoid drinking excessive water at a time. I mean, you must drink water, but not excessive water at a time. And lastly, eat a well-balanced diet rich in vitamins A, C, E, and minerals like zinc and copper. And with a good lifestyle and with a regular eye examination, we are sure that glaucoma can be prevented and defeated, and all of us needs to be aware that glaucoma can be prevented and the vision can be saved, and the vision can be saved. Thank you.